The outcomes of patients with diabetes mellitus in the Philippine Corona Study. Early in the pandemic, diabetes mellitus emerged as a medical condition that is associated with severe COVID-19. There are many pathophysiological abnormalities that occur in patients with DM, making them more susceptible to COVID-19 infection. Patients with DM have a deficiency of complement C4 proteins, which promotes the opsonization and phagocytosis of microorganisms through macrophages and neutrophils, thus inducing the lysis of these microorganisms. In addition, hyperglycemic environment in DM results in increased apoptosis of polymorphonuclear leukocytes, which leads to their deficiency to transmigrate through the endothelium. There is also dysregulation of nitric oxide production in response to bradykinin, consequently leading to vasoconstriction. This phenomenon could attenuate the ability of phagocytes to reach their targets. Furthermore, glycation of immunoglobulins in patients with DM leads to a decrease in the function of the immunoglobulins. Due to the diminished production of interferon alpha and interferon 1, it has been shown that the patients with DM have a decreased antiviral response. Treatment of DM with the use of ACE2 inhibitors and angiotensin receptor blockers can upregulate the expression of the ACE2 receptors as an adaptive response to counteract the elevated levels of angiotensin 2. Type 1 membrane-bound protease called furin, which is expressed in high levels in DM patients, activates the spike protein S on the SARS-CoV-2 to bind to the ACE2 receptors, thereby also making DM patients more susceptible to COVID-19. These processes lead to a deficient immune function of patients with DM, therefore making them more susceptible to bacterial and viral infections. The main objective of the authors was to determine and compare the outcomes of COVID-19 patients with DM versus to those without DM history. This was manifested with regards to the following factors: COVID-19 severity, mortality, respiratory failure, ICU admission, length of ICU stay, and length of hospital stay. The Philippine Corona Study researchers performed an analysis of patients diagnosed with diabetes mellitus based on the accumulated data from a nationwide multi-center comparative retrospective cohort study that involves patients with COVID-19 who were admitted to their appointed hospitals or study sites from February 2020 until December 2020. The Philippine Corona Study encompassed 37 participating study sites where hospitalized patients diagnosed with DM and COVID-19 verified via reverse transcription polymerase chain reaction were identified. A total enumeration of patients admitted with confirmed COVID-19 disease and their data were obtained through review of medical records and encoded using an electronic data collection form using EpiInfo software. Patients with DM were identified through history of having DM diagnosed using any of the following criteria: fasting blood glucose of more than or equal to 126 milligrams per deciliter, hemoglobin A1C of more than or equal to 6.5%, and random blood sugar of more than or equal to 200 milligrams per deciliter in the presence of symptoms of hyperglycemia. The authors of Philippine Corona Study determined distribution differences between two independent samples using Mann-Whitney-U and t-tests. Data on the time to onset of mortality, respiratory failure, intensive care unit admission were used to build Kaplan-Meier curves and to compute for hazard ratios. The odds ratios for longer ventilator dependence, longer ICU stay, and longer hospital stays were computed via multivariate logistic regression. The outcome variables of the research group are mortality, respiratory failure, longer duration of ventilator dependence, ICU admission, COVID-19 severity, increased length of hospital stay, and length of ICU admission. These are the tables from the Philippine Corona Study, which presents the result of the outcome variables. The results and discussion of the Philippine Corona Study. Mortality was significantly higher among those in the DM group by 1.46 compared to the non-DM group. Respiratory failure was also significantly higher among those in the DM group by 1.67. Severe COVID-19 at nadir was significantly higher among those in the DM group by 1.85. ICU admission was significantly higher among those in the DM group by 1.80 than those in the non-DM group. DM patients had significantly longer duration of ventilator dependence and longer hospital admission. The researchers of Philippine Corona Study concluded that the presence of DM as a comorbidity in COVID-19 patients significantly increased the risk of poor outcomes such as mortality, respiratory failure, longer duration of ventilator dependence, ICU admission, COVID-19 severity, and increased length of hospital stay and length of ICU admission compared to those patients without the disease.